Hi guys, my name is Brianna Torres, and today I wanted to talk about a persuasive essay or presentation of mine that it talks about why insulin is so important and why it's important for the price of insulin to go down. So here's my presentation, and it is called Insulin, a Life-Saving Drug, Not a Luxury. The harsh reality. Did you know that 1 in 4 Americans who have diabetes are rationing out their medication because they can simply not afford what they are needing? And I too was a part of that 1 in 4 American. Some people die because they can just simply not afford their medication, and I again too was a part of the percentage. Well, obviously I didn't die, but I came very close to that. Why does it matter to you? You may know somebody who has type 1 diabetes, maybe a loved one, a friend, a best friend, a cousin, a sister, a mom, a dad, a child. So advocacy goes a long way. Rising prices and medication affects everybody, not just us diabetics and our insulin medication, but also you, maybe in your ADHD medicine or your bipolar or whatever medication that may look like for you. This is about human life and not about money. It's not about numbers. It shouldn't be. The message: insulin should be affordable and accessible to everybody, because if it's not, things start becoming very hard on that person. For instance, I'm going to share a story of mine. I've been to the hospital many times after not having insurance. It became very hard because not knowing where to go for medication when you simply just don't have insurance, right? They don't teach you that from a young age. So going from a child to a young adult, that transition was very rough on me. And there were a few times where I was hospitalized from DKA, which is ketoacidosis, and that can be deadly. And there was a time where they told me I wasn't gonna go home, and there's been a time in my life where they thought I was gonna have kidney failure. Well, I didn't have necessarily any major health problems. However, I did come out with something called gastroparesis, and this is a digestive disease, and there's something called flare-ups. Right now, I am not in a flare-up. I am fine, and I have been able to eat fine, but it's a digestive disease that when you eat your food, it does not digest right. And during these flare-ups, well, you can't even keep food down. So that is just another harsh reality of mine, because I had to simply ration out my food ration out my insulin because I could not afford it. And because of this disease, this is a blessing, but it would have been better to have before, right? So now I have an AI pump that delivers my medications, but this is not cheap. It is definitely not a cheap product either, even with insurance. So all in all, and then government regulations and nonprofit support are key to the solution as well. What's the problem? Prices are skyrocketing. In the past 20 years, it has gone up 600%. And that leaves millions struggling not to be able to afford this medication, right? People are forced to choose between survival and affording their medication. The solution. The solution can look like government placing price caps on what these pharmacies are pricing the insulin at. And this is something kind of what Eli Lilly had already done for patients who have Medicare. Their insulin price cap is now at $35 a month, and that is great for people who have Medicare. But that is not necessarily for everybody. Also, you can also support nonprofits like Civica RX. And another way is to expand coverage insurance mandates. And that is like on anything, right? We get these insurances and we still have to pay these big amounts on medications, still almost unable to afford the medications, right? It's another. Now, picture this, right? On the left hand, we do nothing, right? And people continue to ration out their medications, right? What is rationing? Rationing is almost exactly what it sounds like, right? The definition of rationing. So what that looks like for us is, say for a meal. So for me, I do carb count, and I'm on a ratio type deal. So I do like if I have a meal that is 50 grams in carbs, then I take, what is that, 10 units. So because I do 1 unit per every 5 carbs. But say I have 1 vial of 100 units, and a normal meal for me would be 20 units, right? Even though that was a very bad example, but if I'm doing 20 units for every meal, so what, that vial is not going to last me the full month. And if each vial costs almost $300, it's just, I have to ration that out if I don't have the $300. So it's just a lot of cost. Now on the right hand, affordable access for everybody. That leads to healthier lifestyles, that leads to longer lives, and diabetics are able to function at work and have better mental health and better overall performances, and we won't necessarily have these labels that are labeled on to us. It'll save a lot of lives and just better public health, right? What can we do? Let's say, what can we do about it, right? You go and you contact your lawmakers to support price caps, right? You let them know, hey, give them stories, tell them your story, tell them it's important to you, why it's important to you. And then go out and support insulin access campaigns, and then spread awareness. Whether you do this on social media, you can do this by talking to people, you can do this in schools and anywhere, online, in person. Just spread the word, talk about it. And lastly, my final thoughts are, nobody should ever have to die just because they weren't able to afford their medications that they essentially need. Like, they need on a day-to-day basis for every meal, right? They shouldn't have to ration out their medication, and they definitely shouldn't have to choose whether they're going to pay their rent, where they need to live, and also have quality of life, or pick paying for the medication that they rely on to live a healthy life. but those are just my thoughts. And that's the end of my persuasive speech. Thank you guys for listening, and I hope you enjoyed. Thank you.